Hey guys, my name is Kimberly Emo, and today I'm going to be talking to you guys about agnosia. An agnosia is a condition in which a person has lost the ability to recognize places, objects, faces, voices, and this can really impact the way they interact with the world around them. An agnosia occurs when there is damage to a primary area in which our senses are being processed. Typically with agnosias, we see that only one of these modalities is impacted at a time. There are three main types of agnosias. Those are tactile, visual, and auditory. Today, I'll be providing insight on some types of these agnosias and how they manifest in real patients. Let's begin with visual agnosia. A visual agnosia is any type of disorder in which a patient is unable to recognize visually presented objects. So everything about their vision is normal. It's just when something is presented into their visual field, they are unable to recognize it. An example of this is color agnosia. Color agnosia is very different than achromatopsia, which is commonly known as color blindness. Rather, color agnosia is an impairment in identifying and distinguishing colors. For example, somebody with color agnosia would have a hard time discerning that this banana should be yellow instead of blue. Another test that researchers use is color sorting, where they have patients sort blocks based off their colors. Patients with color agnosia tend to struggle with this. Another type of visual agnosia is agnostic alexia. This is a condition in which a person is unable to recognize words visually. They can still write and they can still talk without a problem, but it's recognizing those words that they struggle with. And this can range from more severe forms of global alexia, where patients are unable to read even single letters, to more mild forms of regular dyslexia. Other forms of visual agnosia include topographical agnosia, which is an impairment in recognizing your surroundings, and achromatopsia, which is an impairment in perceiving motion. The next category is tactile agnosia. This is an impairment in the ability to recognize objects by touch. An example of this is autotopagnosia. This is an impairment in the ability to recognize specific parts of your own body. The way this can look in a clinical setting is a researcher asking a patient to point to their left shoulder, but rather the patient points to their right elbow. This can also cause issues for the patients to distinguish between the right and left sides of their bodies. Research has shown that some of these symptoms can be alleviated by allowing patients to look at themselves in the mirror. Other types of tactile agnosia include anosognosia, which is an impairment in identifying objects based off their characteristics like texture and weight, and amorphognosia, which is an impairment in identifying the size and the shape of objects based off touch. The last main category of agnosias we're going to be talking about is auditory agnosia, which is an inability to recognize sounds even though your hearing is perfectly fine. An example of this is amusia. This is a condition in which a person is unable to recognize music. They are unable to detect music from other sounds and unable to recognize differences in pitch. This condition is more commonly referred to as tone deafness. Patients with amusia often have a hard time producing any kind of musical sound, so things like singing, humming, whistling tend to be more difficult for them. Another example of an auditory agnosia is phoneagnosia, which is an inability to recognize familiar voices. Now you may be wondering, how do people even get agnosias? There is a genetic component to certain types of agnosias, but for the most part, people get agnosias from neurological conditions. This includes strokes, infections, tumors, dementia, and toxins like carbon monoxide can also lead to agnosias. Most of the damages that occur and lead to agnosias are found in the posterior parietal cortex and the occipital temporal region. The type of agnosia that a patient will get from an incident depends on many factors, including the location of the damage and just how severe that damage was. There are two main methods of rehabilitation that are used to try to help patients with agnosia. The first method, restoration, tries to improve a function by training it over and over again. The second method, compensation, tries to use an intact function to compensate for one that has been lost. For example, a person with a visual agnosia might train their ability to sense and perceive touch to compensate for the fact that they cannot recognize objects visually. Oftentimes, you will see patients with agnosia working with speech therapists and occupational therapists to overcome some of the obstacles they face on a daily basis. Most, If not all of these conditions have no cure. Because of how rare these disorders can be, their field of study is very under-researched. I think it is very important to push for this advancement and support the National Organization for Rare Disorders. This organization advocates for rare disorders like agnosia in Capitol Hill and internationally. It offers a rare disease database of more than 1,200 diseases and provides educational resources to patients all across the world. I hope this video provided you all with some insight on agnosias and just how complex this condition can be. Thank you all for watching.